I don't finish it, okay? But I'm gonna try my best.
Okay. In the summer of 2015, I noticed a lump growing on my shoulder. It was ½ an inch.
I feel lighter, just walk around, move better. Looks great.
I am so excited about this and what it's going to do for him. I know it's a long time coming.
Yeah, absolutely.
Remember, when you woke up, you were gonna feel awesome and look handsome.
I hope I can help you. I do.
Dr. Lee and I have treated very large rhinophymas before.
And I went back because I had to get the stitches out, and he said it'll eventually go away, and it didn't.
And this is obvious. It didn't
getting-
go
yeah.
away.
Number 4, Melissa. Melissa, burdened by a sizable lump on her shoulder that gradually extended to her neck, embarked on a 3-year journey watching the small bump evolve into a prominent mass. Faced with the challenge of concealing it, she resorted to donning hoodies irrespective of the weather. The lump not only affected her physical appearance, but also took a toll on her self-esteem, prompting her to seek medical advice. Enter Dr. Lee, a skilled physician who, upon examination, identified Melissa's growth as a lipoma, a seemingly harmless gathering of fat cells. With an emphatic understanding of Melissa's struggles, Dr. Lee outlined a plan to address the issue. Melissa, eager to regain her confidence, eagerly consented to the procedure. The day of the removal arrived, and Dr. Lee skillfully excised the entire lipoma. While the process might evoke a reaction akin to the experiences depicted by fans of Dr. Pimple Popper, the result was transformative.
I don't finish it, okay? But I'm gonna try my best.
Okay.
Finding its way around to any free space under the skin, and that's concerning to me.
Hoping for the best right now. I'm not trying to think about the maybes.
Melissa left the office not only relieved of the physical burden, but also adorned with a newfound confidence that had been absent from her life for years. The removal of the lipoma was not merely a medical procedure, but a journey toward self-acceptance and empowerment for Melissa. Liberated from the need to hide beneath layers of clothing, she could now embrace the world.
Blow outside because I have a huge lump on my back and neck.
Girl, you got a pretty big lipoma here, hon.
Melissa most likely has a lipoma, which is a benign collection of fat
In
cells.
the summer of 2015, I noticed a lump growing on my shoulder. It was ½ an inch.
I really have to look at how much numbing I can use, whether it's safe to do this under local anesthesia.
Number 3, Tim. Tim's life had been overshadowed by a persistent growth on his back for a staggering decade, compelling him to seek the expertise of Dr. Lee, famously known as Dr. Pimple Popper. The burden of the growth, previously diagnosed as a lipoma, extended beyond more physical discomfort, casting a shadow over various aspects of Tim's life. The weight of the lipoma had become a formidable force, contributing to Tim's development of a noticeable limp. This not only affected his day-to-day activities, but also took a toll on his professional life. The growth's impact on Tim's mobility was profound, making it challenging for him to navigate the world with ease he once enjoyed. Moreover, the lipoma became an unintended barrier to Tim's personal life, causing him to shy away from the dating scene. Enter Dr. Lee, renowned for her expertise in tackling such dermatological challenges. Armed with a diagnosis that echoed a previous identification of a lipoma, Dr. Lee set out to alleviate the physical and emotional burden that had haunted Tim for a decade. The decision to undergo the procedure was a significant one, as Tim envisioned a life unencumbered by the limitations imposed by the growth on his back. Dr. Lee, known for her meticulous and skilled approach, began the task of removing the lipoma. Aided by her expertise and precision, she was fortunate enough to extract the entire mass in a single procedure. The lipoma, astonishingly the size of a melon and weighing just over 12 pounds, presented a challenge that Dr. Lee embraced with determination. This achievement marked a personal record for Dr. Lee, surpassing her previous accomplishment of removing an 11-pound lipoma. Post-surgery, Tim experienced a profound transformation. The removal of the burdensome lipoma not only restored his physical comfort, but also revitalized his outlook on life.
I guess it started at least 10 years ago. I noticed a small lump.
Good morning to you. Hi, how are you?
Nice
Dr.
to
Lee.
meet you.
Nice to meet you. Where are you from? I hear the accent.
Now it's probably big as a cantaloupe. And I'm just thinking, how big will it get? I feel lighter, just walk around, move better. Looks great. Get this removed, I would go out more socially, date more, and also working be a lot easier on me. Just a little scar, that's it. As far as healing, I think it's doing pretty good. And I'd rather have the scar.
Okay. This is definitely one of the bigger ones we've done. It sticks out through his shirt, you can tell.
You could see it just walking him in, huh?
The newfound freedom from the weight that had hampered his movements for so long sparked a renewed sense of confidence and optimism in Tim. With plans to re-enter the dating scene and a revitalized approach to his professional endeavors, Tim embarked on a journey of self-discovery and newfound possibilities thanks to the skillful intervention of Dr. Lee. Number 2. Roger. Roger, burdened by the presence of large and conspicuous nose growths, sought the expertise of Dr. Lee, renowned for her transformative interventions showcased on Dr. Pimple Popper. Dr. Lee swiftly diagnosed Roger's condition as rhinophyma, a disfiguring skin disorder that not only marred his appearance, but significantly impeded his day-to-day life. These unwelcomed growths had taken a toll on Roger's respiratory function, partially obstructing his nose and mouth, making breathing a challenging task. The physical discomfort, combined with the visible nature of the condition, had led Roger to adopt a reclusive lifestyle, rarely venturing beyond the confines of his home. The burden of the rhinophyma, both physically and emotionally, cast a shadow over his life. In a momentous turn of events, Dr. Lee featured in Roger's case in Season 6, Episode 2 of Dr. Pimple Popper. During this episode, she collaborated with specialists Dr. Osborne and Dr. Hamilton from the Head and Nose Foundation. Together, they embarked on a mission to alleviate Roger's suffering and restore both form and function to his nose.
I got a call from Dr. Sandra Lee. She called and she reached out about a patient.
First is the intubation and anesthesia, and this is risky because of a potential airway obstruction.
He's not really a cancer case, so he doesn't fit in a head and neck oncologist's office, so he would fall through the cracks in a normal situation. Trachea, and then put the tube in there, and then hook him up to the anesthesia machine.
I am so excited about this and what it's going to do for him. I know it's a long time coming.
Yeah, absolutely.
Number 2 is the removal, which is risky because of the loss of blood. And number 3 is reconstruction.
Do you have any questions for us?
When are we gonna start?
When are we gonna start?
You're excited,
Great
aren't you?
question.
The procedure involved the meticulous removal of the rhinophymatous growths and a subsequent reconstruction of Roger's nose. Dr. Lee's collaborative effort with the experienced specialists showcased the potential of medical intervention to bring about transformative change. The surgical expertise displayed on Dr. Pimple Popper highlighted the dedication of the medical team in addressing challenging dermatological conditions. Post-surgery, Roger experienced a profound shift in both his physical and emotional well-being. With the burden of rhinophyma lifted, he no longer faced the challenges of restricted breathing and social withdrawal. For the first time in 11 years, Roger looked in the mirror and felt a renewed sense of handsomeness and self-worth. Grateful for the chance to reclaim a normal life, Roger's journey served as a testament to the power of medical expertise and collaborative care in overcoming challenging dermatological conditions.
Honey, open your eyes. Hi, we are finished.
Hi, you look fantastic. I hope I can help you. I do.
Dr. Lee and I have treated very large rhinophymas before.
This is one of the most amazing transformations I've seen. Certainly, I'm so proud to be part of it as a dermatologist here.
Remember, when you woke up, you were gonna feel awesome and look handsome.
But this is certainly something where you need more pairs of hands and more brain power.
It's going to look even more amazing when we give Roger some time to heal.
Number 1. Dr. Pimple Popper, a TLC show host, has been treating patients with old cysts for years. One such patient, Josh, has an 18-year-old head cyst that has been growing larger and causing him pain. Josh was a victim of a head-on car accident at 19, which left him with a head injury. Despite being pronounced dead upon arrival, he miraculously survived. John's cyst, which resembles a golf ball cut in half, is soft and mushy, and he can move it around without pain. The knot comes from where he hit his head on the windshield. Dr. Sandra Lee, a specialist in head cyst removal, took a close look at the cyst and decided to try and remove it in one piece. Dr. Lee squeezed the cyst, which oozes yellow, wet skin cells. She compared the substance to grits, which Josh responded with cheesy grits. The cyst was then removed, but Dr. Lee was concerned about the possibility of it returning due to the trauma of the accident.
How long have you had this bump?
I had a car wreck, and
I see.
when I come home from the hospital, I was in there for a week, and it started off as like a little pebble. My knot started when it was probably about a marble size, and it has gotten bigger. And I went back because I had to get the stitches out, and he said it'll eventually go away, and it didn't.
And this is obvious. Obviously,
kept
it didn't go away.
To me, it looks like you cut a golf ball in half and just set it on the side of my head. It's soft, it's mushy.
Okay. Sometimes this can be caused by trauma, car accident, maybe hitting your head really hard, or maybe falling.
When someone makes a comment, it makes me frustrated, and it's not a pretty situation.
To the environment, it's now shedding out underneath, creating a sac, creating a cyst.
Josh was shocked by the results and eager to show his wife and daughter his new head. Fans of the show were impressed with the results, with one commenting, "Incredible. He must be really happy. Seems like a very nice guy." Another wrote, "Look at how happy he is. It warms my heart seeing him like that, like he's finally got his life back." In conclusion, Dr. Pimple Popper successfully treated Josh's 18-year-old head cyst, which has left him feeling confident and happy. That's all for today's video, folks. See you next time.